Hi, this is Nancy Walton from the Autism Support Network Society. This is the second video in our online series, Treatment Options. By simply Googling autism treatment, you will get all sorts of treatment options. How do you choose which one to use? As a scientist and an educator, the first thing I did when my son was diagnosed at age 2 was to look at the research on autism interventions. What you will learn in this presentation is how to recognize good research and not fall for pseudoscience. Therapy of any sort should be backed by research, science-based research that is published in peer-reviewed journals. This might be through treatment group, control group research, or a meta-analysis of single participant research. Let me briefly explain treatment group, control group research. Both groups should be equally represented in every way except one group has no treatment, that's the control group, and the other group receives treatment or intervention. The idea is to see if the treatment group has significant gains over the control group. Here's an example of a study done in Norway with grade 1 students on the autism spectrum. All students had one-on-one support. The control group had general special education. That is what is offered to students here in BC and pretty much any public school across Canada. The treatment group had ABA education. Keep in mind that both groups had one-on-one support. The students were assessed by psychologists who did not know which group the students were in before and after the treatment. Here is the results of the study. EIBI is another term for ABA, by the way. The study was published in the Journal of Behavior Modification without this graph. I put numerical results into graph form so it's easier to see the effectiveness of the treatment group. Before treatment, there was an average psychoeducational gap between the students with autism and their peers. In the adaptive behavior tests, the ABA group made gains relative to their neurotypical peers. The control group kept the same gap. In expressive language, the ABA group made even more significant gains, catching up to their peers. In the control group, the gap got wider. The special education students fell further behind. You will notice that without treatment, as your child gets older, the gap between your child and his or her peers could widen. And then the same with language comprehension. With IQ, general special education is able to raise the IQ of a child, but not as significantly as the ABA group. I presented this research to the Surrey School District in the year 2002 and asked them which group would they want their child to be in if he or she had autism. Now I want to stress to you the importance of understanding the placebo effect. This is important in research. The easiest example of a placebo is when a control group is given a sugar pill instead of a treatment medicine, and they think they are getting better, even though they're not actually getting the treatment medicine. In the case of children with autism, their parents may think a treatment is making their child better. The belief that a treatment will work can affect the outcome. This is why testimonials are not a good source for evaluating treatment options. Here's an example of how a testimonial might work. At age 2, we took my son off gluten and casein, which is milk products, because that was the word-of-mouth treatment at the time. At age 4, I decided to reintroduce wheat, as I was not convinced it affected his behaviors and did not want to inadvertently create a sensitivity to wheat. At that time, my son started talking. He was not talking at all before this. The therapists were jokingly asked what I did differently, and I said I reintroduced wheat. So my testimonial would be that you take your child off wheat at age 2 and reintroduce it at age 4, and your child will start talking. But really, it was just that my son was ready to start talking, or perhaps he had a new consultant who was good at targeting language. But think of this. What if I had decided to take him off wheat at the age of 4 instead of at the age of 2? I would have been convinced that going gluten-free made him better. That becomes a parent testimonial. How does the average parent make sure they are getting science-based treatment? One way is to check on asatonline.org. ASAT stands for the Association for Science in Autism Treatment. They have a peer-reviewed research summary and they give updates on other therapies for you to help determine if they are effective. They have a savvy consumer section, which does exactly what I'm trying to do in this video today. Help you spend your money and time on effective treatment for your child so he or she can reach fullest potential. I really hate to say it, but there are a lot of people out there who want to make money off of us. And there are other people, even social workers and doctors, who spread misinformation. It will be up to you as a parent to be a savvy consumer. Don't fall for pseudo or celebrity science. Celebrity science is when someone, like an actress, gives a testimonial, something that worked for them, perhaps something like starting a gluten-free diet, and claimed that that diet greatly improved the child's functioning. Remember that testimonials are not evidence. There might be more at play. Try to avoid getting lulled by parent testimonials. As much as I love chat groups for locating good consultants or pediatricians and for moral support, unfortunately, you will also hear testimonials. And just because someone writes a book or has a news report done on them does not mean that you are seeing it as an effective treatment. Another story to illustrate my point. Recently, there was a research study to find out the effectiveness of hyperbaric oxygen therapy for autism. The news got a hold of this story and they ran with a mom holding her son in the hyperbaric oxygen tank. She was sure this therapy was working. Suddenly, lots of people wanted to try hyperbaric oxygen therapy. This is extremely expensive. But the research actually proved that this was not an effective therapy for behaviors associated with autism. ASAT rates it as what doesn't work or has no research to back it. So what does work? Quality research has shown that most effective approach to helping children with autism to reach their full potential is intervention based on the principles of applied behavior analysis, or ABA. ABA, if done correctly, can allow children with autism to learn new skills and can help reduce inappropriate or harmful behaviors. Applied behavior analysis, or ABA, is a branch of psychology. It is not a particular tactic or technique. It uses a variety of tactics depending on each child, and it targets different skill sets depending on what the child needs. ABA involves the systematic teaching of skills, not random or disjointed. It's very systematic and thus can be more successful. ABA breaks down skills into much smaller, teachable tasks. For example, opening an umbrella may seem straightforward to a neurotypical child once they watch another person do it. But for a child with autism, you might have to break down this task into 5 distinct steps. Point the umbrella tip down. Hold the sliding part of the umbrella with the left hand. Push the button to release the sliding part. Slide the umbrella open until it clicks into place. Raise the umbrella over the head. This breaking down of skills can be done for learning language, tying shoes, brushing teeth, playing a musical instrument, anything that you would like your child to learn. In ABA, positive reinforcement is used to motivate the individual to learn each skill. For example, when a child says "Mama," the mother responds with glee and the child thinks, "Wow, she liked that, I'll say it again." But a child on the autism spectrum may not pick up on that subtle reinforcement. So they might not learn to talk if they are not picking up on the subtle reinforcers from people around them. ABA makes this positive reinforcement a lot more obvious. ABA is based on the idea that if you positively reinforce a behavior, the behavior will happen more often. ABA has a strong focus on what happens after a behavior. What happens after a behavior is what drives that behavior to happen again. ABA relies on data for making future decisions. If you are running an ABA program and data is not being taken, that is not going to be a very effective ABA program. You could argue it's not ABA at all. The whole idea behind the word analysis in applied behavior analysis is that you analyze data. I will explain more in the next video. And as I said before, ABA uses a variety of tactics. ABA is effective at any age level. In a parent meeting recently, twice I had parents say their social workers told them that ABA does not work on older children. That is a myth. Often professionals will give out hearsay, or they may pass on what a non-ABA service provider friend told them. I personally know someone whose son started ABA at the age of 14 and went from a modified school program at a school where integration involved sitting in a classroom of kids who bullied him all day to a full graduation program in a school where he was able to join the drama club and acted in a play. his life improved considerably. So keep in mind, teachers, social workers, and even doctors may not have training in autism treatment during their certifications, and there's no requirement that they stay up to date with the latest research in autism interventions. So it's up to organizations like the Autism Support Network and the Association of Science in Autism Treatment, or ASAT, to make sure that parents have science-based information. It's up to the parent to be a savvy consumer of autism services. Back to the point that ABA is effective at any age level. Remember, ABA is not a particular tactic. While a younger child may be learning to say single words, an older child might work on having conversations with peers or learning about appropriate behavior in public. Why treatment? Keep in mind that any behavior your child has now will continue into adulthood unless replaced with other behaviors. It is rare that our children outgrow behaviors. In most cases, they become more entrenched and harder to manage. Children on the spectrum with lower support needs might do well academically, but can become prone to depression due to lack of connection to others. When children are in an ABA program, they can have very positive, fun interactions with behavior interventionists regularly. They can learn that interacting with people can be fun. And most importantly, ABA helps your child live in this world rather than making you, the parent, build a world around your child. For example, my son developed a fear of microwaves at the age of 5. Eventually, the microwave problem carried over to all microwaves. So whenever we visited friends, we had to ask them to move their microwaves out of sight, or our son would freak out. This is a lot to ask of a friend. So we used ABA to target tolerance to the microwaves. We videotaped the microwave and played it with the sound off. My son would scream and cover his ears while we fed him chocolate chips for 10 seconds that the video played. Sounds terrible, but after that first trial in this program, my son actually went up to the VHS machine by himself, rewound the tape, and played it again. He'd run behind a wall with his ears covered and take looks at the video. He would do this over and over again. Eventually, he started to take his hands off his ears, and finally he was completely calm during the video. We defined levels of anxiety and took data on them as he did this process. Once he was calm a targeted number of times, we turned the sound on, and then the process started all over again. Once he could tolerate the microwave video with the sound on, we brought out an actual microwave, and he was completely fine. In fact, the microwave, and later all of the things he was terrified of, became his favorite objects. Most importantly, we were able to visit friends without asking them to put away their microwaves. This is a process that was hard at first, but it completely freed my son very quickly. He can go anywhere and does not need noise-canceling headphones or special requests. It made his world bigger and improved his quality of life. I will leave you with that. I'm hopeful that you will start up a quality ABA program for your child so that he or she can learn new skills and deal with problematic behaviors. The next video will show you what a quality ABA program can look like.